Jai Hatkesh, Vishnagara Upnagar Mandal and Vishnagar Kelodni Mandal is running a program of young achievers. And the tagline for the young achievers is Apna Din Aayega. So today we have guest Dr. Foram Pandya, married to Dr. Saumil Pandya. Incidentally, Foram is not from our community, but we are happy to invite and make you the part of community. And that's why we are talking to you as a community member. Welcome, Foram. Dr. Foram.
Thank you so much.
Yeah.
Jai Hatkesh.
Jai Hatkesh. Oh, that's nice. That's nice to hear from you. I should have said Jai Jitendra, right? That's
Jitendra, yeah.
yeah. So, Forum, you done your MBBS from Grand Medical, then you done your masters in MD Radiology from JJ Hospital. You also worked at Hinduja, and now you are in private practice. Along the way, you also done your radiology from Royal College of Radiology, UK, and of course, probably you found Saumil along the way because you have done almost at the same time. So I want to start asking, where and how did you meet Saumil?
Yeah, so I entered my specialization in radiology in JJ, and he was my senior over there. So while we were doing our radiology study in our PG post graduation, we met there, and that's how we came to know each other.
So if I can ask you a personal question, who initiated first?
Saumil.
Ah, how nice, how nice. Always. Okay, so coming back to your starting your MBBS, you were a rank holder. Was that for MBBS or was it for the MD?
Both MBBS
Both.
as well as MD.
So you were a bright student in school?
Yeah, I was always very studious and hardworking and the typical girl kind of thing
Okay,
who is focused. So
okay,
obviously I've had different hobbies. I've done a lot of dancing. I've done a lot of extracurricular stuff. But when it
okay.
came to studies, I was always a bit focused. And I was like, and I was all this thing, studious, and I will do my
Studios.
best.
So you are
Yeah,
born and brought up in Bombay, are you?
yeah, Mumbai.
Okay. And when you say that you also had other hobbies and you said dance, so did you pursue Arangetram and all that, or it was film dancing
I
or
did
whatever?
no, I did Kathak dance for around
Okay.
3 years. I did classical training in Kathak. I also did singing for 3 years,
Oh,
and I did karate and a lot of things, a lot skating and a lot of stuff. So basically, it became jumbled and it was like jack of all but master of none types.
you
So
are
it
a
was
master in radiology anyway.
yeah. So
Yeah.
I did a lot of extracurricular, but always for around 3 years, 4 years, but not the complete um,
And this was
thing.
during college time or this was during school time?
No, school, because the moment you enter 11th, 12th and you start pursuing your medical career, you get a lot of less time.
So between karate and dancing and singing and what have you, when did you decide to become a doctor?
So my thing was not actually the very cliche thing, like I want to help the society and stuff. First, it started off, I wanted to become an astronaut. I
Astronaut.
always want, yes, I used to love the outer space and I was like, I want to do something there. But at that time, I didn't find any way to, pursue that.
Okay.
Then the next thing I used to always like is I was very fascinated by the detectives who used to be the Sherlock Holmes and all. And
Oh, so
I
you
used to
did lot
be
of
like,
reading as well, is it? So where you were reading Sherlock Holmes,
yeah.
not
I'm
Enid
not
Blytons and
listed.
all that, not Enid Blytons.
No, not that much. I used to love detective series, thriller
Oh,
novels. I didn't
okay,
the normal novels. I used to do a lot of thriller novel readings.
okay.
So then the next thing that came to my mind was like, okay, if not a detective that way, maybe like a doctor who is a detective in a different way. Like a patient comes to you and he comes with some kind of symptoms, and then it is your job to decide, okay, what is exactly happening to the patient and what is going wrong. So maybe not a detective, but a different kind of stuff. So that is how I actually developed this interest in, okay, chalo, I want to pursue, become a doctor. And then when I started my medical career, then all the social helping thing and everything came into, because till that time it wasn't the society helping which drove me to become a doctor. It was my inner interest which drove me.
Are there any doctors in your family, or you're one of the first doctors?
uh, Not direct, but yeah, my relatives and cousins, far off cousins and my mamas, they are doctors,
Okay.
but not the direct family.
So did they play any part in guiding you in becoming a doctor, or it was your own particular focus, as you say, or your zeal, or your passion, or whatever you call it?
Yeah, they did play a role in guiding me. They did help me out by telling me things about the practicalities of the medical world and stuff. So it was a kind of help. It was kind of an actual world realization also. Both the things were there, but ultimately I followed what I wanted to.
Okay. So, so would it be right to say that a youngster in school should be equally active in extracurricular activities other than being good in
Yeah,
studies? Because you said you were studious, so you found time for your studies. Were you always a
yeah, yeah.
topper in your class, or first rank, second rank types, or
Not
uh,
exactly, but yeah, amongst the first 10 rankers, I used to stand.
okay, okay. And obviously, you must have scored good marks in 10th and 12th and your entrance exams and things like that. Yeah. So how did you manage your time? So if you were to address somebody who is 10 years younger to you and probably who is in school or just about entering a college, how would you advise or suggest to him to find time to do more than one thing? In my view, students typically do two, three things. One is they try to
Yeah,
attend college, other than medicine.
yeah.
Yeah. Two, they have a lot of time to sit in the canteen. Three,
Hmm.
they have a lot of time for WhatsApp and Facebook and what have you, and chit chatting with friends and what have you. And therefore, not much time for extracurricular activities or
See,
arts or
now
whatever. Yeah,
nowadays with a lot of social media, your time gets eaten up in Facebook, Insta, uploading posts. When we were young, that time we didn't have social media, so we were a bit lucky in that way.
yeah,
Our time spending was to do extracurricular activities, go down, play and stuff. But right now what I see, the present generation, they are with their gadgets all the time. They are busy uploading pics, checking out other people's posts, how many likes. So the world has changed a lot, and
yeah.
it has its positive points as well as negative points, so we need to balance it out.
True. You have to always balance it. Yeah. Also, because of the maybe 200, 300 channels that is there in the TV, or the mobile
Yeah,
being given to children at a very young age, maybe 5, 6 years. And now with this COVID thing, schools are running on Zoom and on laptop. There is a huge
yeah.
issue of attention syndrome, attention
Hmm.
deficiency syndrome, right?
Yes,
Uh,
yes,
what would be your take on that? I mean, what would be your take as a doctor and uh, as somebody who says that you need to spend time on yourself, on your activities, on extracurricular activities?
definitely. I have observed that, from a very young age right now, when the child is a bit naughty and not listening and all, the parents give away some kind of gadget to just keep the child quietened. Like he should not. The parents are busy also because the work stress has become a lot now. That this is a way that they try to, balance the situation. So no one's to blame right now. The world is changing. So these things are developing as an indirect effect, uh, because of the work stress, because of the present life. People succumb to gadgets as their second friends. So
Yeah,
other things that we did in our childhood days are not there right now. Like if you see the young generation right now, they'll be all busy with their phones all the time. They'll be locked up in a room. There are so many web series which we didn't have at that time.
true.
So that's what I would say. Ki at a very young age, you should refrain from all of that. Enjoy your childhood like it should be, and then as you grow, these things are going to come into.
So when you did your MBBS and you wrote your entrance, you were a rank holder. Why did you choose radiology?
Yeah, so radiology is something which is very, very interesting because it deals with the entire system, body system. It's just not related to one part. And also, to be very true, is something like when I was in my internship days, I had decided I want to do something which is a bit less stressful, like as a girl's perspective. This is very truly, that's what I'm saying, key something which is a bit less stressful. So your radio, your skin, your other fields come into that kind of a picture.
Typically,
So
ladies
it's
would go for gynaec also, isn't it? There is an X element of
yeah,
comfort being in a gynaec.
yeah,
Yeah.
yeah,
But
yeah,
radio, as you say, typically is less stressful. At least you can maintain some office timings, if you
yeah,
can use that word, and you can be
yes,
at
yes,
home.
yes.
You can also attend to your
Yeah,
family, and yeah, you have
yeah,
that added
yeah. You can
responsibility.
choose not to have emergencies, and there are a lot of beneficial factors with radio also. So that was also a perspective I kept in mind. Other than it being interesting and stuff, that is definitely there. But also one of the perspective was it was a bit less stressful.
Less stressful. Yeah. You said that being a doctor is also being a detective to some extent. Can you elaborate that a
Yeah,
little
that was
bit?
when I was young.
Yeah. So can
Yeah,
you elaborate
because
that?
when I was young, yeah, I was young that time. I used to always think, like when you go to a clinic, you say you have this. You give him around 4 to 5 symptoms. I have fever, I have diarrhea, I have this, I have stomach pain. So ultimately, it is the doctor who will look at these symptoms, who will try to come up with some kind of history, will try to ask you some questions, find out the etiology, do some examination. So it is a different kind of detective altogether, detective of the body basically.
Detective of the mind, you think? Because the patient would say what he sees about the problem rather than the problem itself. Even that could be a, yeah. Is
Yeah,
that, does it
that is
happen
also
that
there.
way? Yeah.
Yeah,
So now with the COVID,
yeah, we
there is,
maintain zero days.
yeah. Sorry. Go ahead. Go ahead.
No, it's fine.
Yeah. Now with the
No,
COVID,
that's what I'm saying, we maintain zero days.
yeah. So now with the COVID,
No,
see,
it's fine.
so therefore I've been reading and I know that bedside learning for a doctor, a bedside treatment of a patient, interaction with a patient plays a very important role in a patient-doctor relationship, right? Now with the COVID and
Yes,
the way the world is going to change, telemedicine is becoming or is going to be a norm at least for a lot of time. I mean, that's the way at least people are saying. I mean,
yes.
that may be the new normal. So what is your view on that? Is that going to somehow replace the bedside relationship that is there between a doctor and a patient?
No, the bedside relationship is very, very essential. Many times, other than anything, psychology plays a very important role. Even if the doctor just touches your body and just, if your stomach is aching, he just examines the stomach. After some time, the patient feels that the pain has gone away. And the psychological factor is very important for the patient. So just with the telemedicine, that deep bond, the emotional bond, the psychological factor will not come into. Plus there are many other signs, subtle signs, that through the telemedicine you cannot understand. It is only when the patient is in front of you, that even if the patient is not realizing what is happening to him, by just looking at the posture, the way he's sitting, the way he's standing, he's walking, you will realize a lot of things.
So one is the bond between the patient and the doctor. If I can ask you this,
Yeah,
how much is the placebo effect in all this?
there is a lot of placebo effect, definitely, because many patients are just anxious. There might not be anything, and they might just feel that, my stomach is paining a lot and stuff. And the moment they go to a doctor, they feel okay, now fine. There is a lot of attention deficit which is there these days. Many people just go to doctors because they want some kind of attention, maybe from the doctor, from some kind of family members. So a lot of placebo effect is there.
Lot of placebo effect. Yeah. Uh,
Yeah.
Coming to your days when you did your MD and you're practicing on your own now with some organization. If somebody wants to choose his career, professional career.
Yeah.
What is the age when he should start thinking about this? I asked this question to Saumil also, and I want to repeat this question to you as
Yeah.
well.
Yeah. I would say the age that the person should start thinking is maybe somewhere around ninth, 10th, not before that at all. Ninth, 10th, just have a perspective as to which general category you want to go into, because you have to choose at the 11th with the science, commerce, arts. And even do not streamline yourself even in that broad think, I just want to be this, I just want to be that. The world has expanded a lot these days. When we were young that time, yet there was a lot of streamline, doctor, engineer. Now there is so much of so many fields opened up that okay, 9, 10 you need to generalize, come down to a categorical thing that you want to go into this kind of stream, and then further you can follow your passion, what you actually want to do, and not streamline yourself.
True. Uh, Another question that I have is that you said that you chose radio because it is not exerting. You've been married, I don't know how many years, but I'm sure a few years, and you would have as a female member of the as a couple, you have added responsibility for your children as compared to the society that we are in. So, if you were to address some young girls of our community who want to choose a career, who want to make a career of what they have done in their profession, and also maintain a good family setup, what would be
Yeah.
your take on that? I mean, how do you balance work-life balance, work-life and family balance, and children? Uh,
Yeah.
yeah, yeah,
It's difficult balancing all these things, especially in a field where you're a doctor, because your work is a lot stressful, where you're dealing with patients' lives. There's a lot of tension. There is a lot of responsibility on your head. If a minor mistake of yours can also, play with someone's life. So it is a lot of stress which is there. But at the same time, I would advise any young female to follow her passion. Basically, the first thing should be that if you have a passion for something, maybe even if it is more stressful, there will be a way that you will be able to manage things. So do not give up your passion. My passion was radiology. It wasn't that only because of less stressful that was a thing. I wanted to do radiology truly from within, and an added factor. So your first thing, okay, a girl wants to be a surgeon, go ahead, do it. That should not be something which should hinder you. uh, I'm saying it is difficult to balance, but there will be a way out. So just follow your passion, and you will understand how to go about with things as you grow later.
you were doing so many things when you were in school, like your skill, your skating and your karate and your singing and your dancing and so many other things. Are you following any of those passions now, or there is no time left for it?
To be true, after my 11th, as after the 11th, I could not follow these passions. When I was in my MBBS days, we used to have this dance event, annual college event, full dance program, dance night. In that, I used to take part. And in intermittently I used to get time. During MD we didn't have much of time, during bond we didn't have, but luckily in this COVID period we did again get a bit of time, because there was a lot of in the beginning there was a little less patient load for us, so again we could follow our passion a bit. Yeah, that's the only thing.
Okay. So we are coming to almost to end of the time that we had slotted for you, Forum. If I were to ask you in a few sentences, any suggestion that you would want to give to the youngsters, the 5, 10 years younger to you, in terms of your dreams, in terms of your aspirations, in terms of your extracurricular activities, what would be that suggestion, that advice, that whatever you call it, that you would want to share and address to them?
My only suggestion is follow your passion. You do not need to be fixed, that this is good, this is not good. Now the world has expanded a lot. There is a lot of career options available. And if you want to truly excel in anything, there are many, many, many opportunities and stages which have opened up right now. So just be focused, excel in whatever you do, gain the skills that will help you to excel. You will require to work hard. There is no substitution for hard work. So that's the only thing. Hard work is needed, your passion, and also you should do something that you will love. So automatically you will excel.
And you will still find a way to manage your family as and when you go the family way and you have added responsibility. Yeah, so if I were to wrap up for you, first of all, thank you very much. We had a good time, I think. You had a lot of insight to share. Uh, what I would take home as a takeaway from this talk is that one, that you should have your passion, that you should love what you're doing, that you should take your extracurricular activities seriously, at least till the time you get into serious studies, and that there is no substitute to hard work, and that once you have joined your profession and once you have started making your career, as you go up your graph in your career, you will always find ways to manage your family and your other demands that may have on you, especially being a female member of the house. Having said that, I think have I left out anything, Foram, Dr. Foram?
Completely covered.
Okay, thank you. So it was a pleasure talking to you, doctor. All the best. It was, again, as I said, pleasure talking to you. And I'm sure some girls out there in our community who would be watching this would find something interesting which will help them decide and find out what their passion is, and therefore take a decision which will help them, which they love and which will help them all through their life. Thank you. Jai Hatke. Jai Jitendra.
Yeah, Jai Happy. Yeah, Jai